Welcome to Neosciencehub. Today we are going to interact with Dr. Soumya Swaminathan. During COVID time, why did people reject science? Was communication missing? Emotion, trust, culture? What must change for Viksit Bharat 2047?
I think from my own experience, I could say that during COVID, we learned quite a few things about science communication. The first one is that we were communicating facts in a very dry, scientific, maybe a technical way, and we didn't realize that the response of people to COVID was actually quite emotional, and we were not addressing that emotional component, because as you mentioned, there is fear of the unknown, there is sort of confusion, some feelings of mistrust, particularly in certain countries. There was mistrust between the people and their government, or between the health system and the people, because of their past experiences. So I think some of the lessons that we learnt, which I think we should apply now for Viksit Bharat, when it's really important for us to communicate science well to the public. First is that listening is very important. We need to listen to people, and today it's I think relatively one can do it by using AI, for example, and social media, to understand what are the themes that people are discussing, what are their concerns, their worries, and then try to use our communication channels to address some of those questions that are in people's minds. So the first thing is listen. The second is communicate not using jargon, but as if you are talking to the people, and in the tone in which people will understand, not like somebody who's actually preaching or talking down to people. The third is use people to communicate who are the trusted people in the community. These could be, religious leaders, they could be teachers, they could be doctors and nurses. These are people that generally communities respect, look up to, listen to, and trust. So I think using those voices for communication is also very important.
Ma'am, India has enough food but poor nutrition. How do we clearly explain why nutrition diversity matters?
So today I think there used to be a time in India when we were short of food, and the main goal was to really improve and increase food production and yields. Today the question to be asked is, does everyone have access to the right food, nutritious food? And so we have to change the conversation from let's produce more food and eat more food to, are we getting the right types of food? Are we getting enough micronutrients like vitamin A, vitamin D, vitamin B complex, zinc, selenium, iron, and are we getting enough adequate good protein as well, good quality protein? And when we analyze the Indian diet, we find that a lot of people are deficient in these. So we need to also address it in a way in which people will understand. So for example, if we are talking to students, we need to talk about why nutrition is important. Do they want to be strong? Do they want to be good athletes? Do they want their intelligence, to perform well cognitively as well, and how nutrition actually builds up some of these. If we're talking to farmers, we need to talk not just about their yields, but we do need to address the income. We need to address the need for diversity in the farms so that they can also protect themselves against climate impacts and climate shocks. And if we are talking to a consumer, let's say a housewife who's the one who prepares the food, we need to really talk about what's in her kitchen, how does she access healthy products, and why it's important to minimize the consumption of ultra processed foods and actually eat a very diverse kind of a diet based on locally available and relevant solutions. So there's no point telling people to buy and eat things which are either very expensive or not locally available. So this is why I think the communication messages also has to be made and delivered by people who understand the local context.
Ma'am, when science is suppressed, how should communicators protect truth and public trust?
So this is a difficult question, and it's also in some countries now becoming very difficult to protect science because of the very strong anti-science movement. I would say that in India we don't have that problem. At least till now, there is no big anti-science movement. But as scientists, we need to be able to communicate very honestly, openly and transparently based on the real data and evidence that we have before us. We also need to be humble enough to accept the fact that science is constantly evolving and changing, and that we should be prepared to change our minds and change our views based on the evolution of science and technology as well. So this is why we need a very open and transparent communication, and that's actually the way to also build trust in science and scientists.
Ma'am, why does global health advice fail locally, and how should science be communicated differently in India?
So again, there are a lot of lessons from COVID, because the kind of advice that was being given at the global level sometimes was not at all relevant or appropriate for the local context. For example, this whole thing of isolation, we were telling people that you should isolate yourself. Now, if you live in a house which has many bedrooms, and you could go, when you are infected, you can go and stay in one of those bedrooms, and the rest of the people could still be in the house without posing a risk. Whereas if you look at any low income community in the world, in any of the developing countries, you're talking about 8 or 10 or 15 people living in a very small house, or even in one room in a city like Mumbai, for example. So there the context is very different, and so the health advisories also have to be different. So this is again why there could be, of course, norms and standards set by global health agencies like the WHO. They need to be adapted and they need to be contextualized. In fact, for a large country like India, even doing it at the national level may not be sufficient. You'll need to do it at the subnational, that is state and district level. So ultimately the response for health emergencies has to be decentralized, and there has to be capacity at the district level to both communicate based on data and based on the local solutions, but also enough expertise has to be built at the district level to come up with the appropriate solutions depending on what the threat is.
Ma'am, why does strong science often fail to shape policy, and what should communicator and journalists do better?
So I think the kind of science forums that Neo represents is a good model. It brings people together. You need to bring scientists with lay people and communities. You also have to have many more platforms for scientists and policy makers to talk to each other, because often there's a gap, and scientists don't quite understand or appreciate the environment or the constraints with which policymakers have to make policies, and vice versa. Policymakers also don't fully appreciate what motivates and drives scientists. So I think these open communications, maybe even challenging each other, having frank discussions, makes both sides see the sort of motivations that drive people. And then when we communicate with the lay public, I think journalists and the media play a very important role to actually make the scientific messages much more appealing, much more understandable, and also tell it in the form of stories, because stories are what actually stick in people's minds rather than pushing a lot of dry facts out there. So we need many more science journalists to be doing that.
Climate change is often seen as an environment issue. What is the one health impact of climate change that Indians are most underestimating today?
I think that there are two big climate issues that our Indians are already facing and which is already impacting our health. The first is air pollution. There's hardly anywhere in India where the air quality is anywhere close to the standards set by the World Health Organization. So we're all breathing a mix of pollutants which is impacting our health in many different ways. Not only is it giving us more respiratory illnesses, it's impacting our cardiovascular system, increase the risk of heart attacks and strokes, also increasing the risk of diseases like diabetes and other chronic diseases, as well as dementia. And it's especially having a very bad impact on young children, because their organs are still developing, the brains are still growing. So when young babies are exposed to air pollution, probably they're getting impacted for life. So I would say that's the number one health threat The second one would probably be heat, because large parts of India are now going to be are increasingly exposed to prolonged and severe heat spells, and this has an impact on us in many different pathways. It impacts human health, and so we really need to be preparing ourselves and adapting to this a world that is warming very rapidly.
Ma'am, if you had to give one clear message to policymaker and citizen to protect health in warming world, what it would be?
A few things I would say. I think one is understanding what heat does to us and how it impacts our bodies. That will actually help us to take protective measures. So depending on the kind of occupation that one has, the kind of environment that one is working or living in, the solutions could be a little bit different. So understanding the heat impacts on health, how to protect ourselves, when to ask for attention from the health system, to go to a doctor or nurse when you have symptoms. Don't wait till it is too late. And also from the health system side, they also need to make actually some adjustments to prepare for an increase in heat related illnesses. So we also need to have cool rooms, we need to have cooling solutions, we need to have the healthcare workforce actually trained in responding to heat. For all of this, I think we need a science-based climate and health approach strategy, which then develops the solutions and has them implemented. And these are usually multi-sectoral. So some of the solutions could be within the health system, but many of them will be outside the health system.
When you are not working, what do you enjoy the most, ma'am?
I enjoy being out in nature, and I'm happiest when I'm walking where there is beautiful, and obviously then that means that you need clean air. Hopefully you're looking at greenery and at a beautiful environment. So if I have time off, I try to find a nice natural environment where I can go and spend a couple of hours.
This is the overall India's first magazine. Especially in Hyderabad, this is the first magazine, Science.
So I would like to thank and congratulate Neosciencehub for all the work that you do in taking science to the public.